To start here, you guys got your food in hand. I'll put mine down on the right. You'll have to see me eating as I talk here. Nobody wants that. So I'm Dr. Rob Roth, naturopathic doctor. I'm a herbalist. I have a practice where I do a lot of pain management and injury rehab, which is I do a lot of prolotherapy and platelet-rich plasma, where we do kind of joint regeneration. It's a joint regeneration technique. I do that out on the West End, 17th Avenue, 69th Street. I do a little bit of family medicine as well. In that umbrella, I do a little bit of oncology work. It's a little bit about me. Any of you guys, any of us not had the pleasure of meeting before? You guys know me? You guys all had the pleasure of meeting Megafood before? You guys have all had a training on it? So you guys are really excited to go through the process and learn about Whole Foods again? I don't see a lot of head nods, so I took the liberty of modifying it a little bit. So we're going to talk, it's about Megafood, and we'll talk about some of the key pieces here with Megafood. But I wanted to maybe take a bit of a different tact this morning than just the same spiel that you guys have heard me say probably a dozen times in some of our trainings and so forth. But if you have any questions, as always, please feel free. We can make this as conversational as you guys would like. But we'll start off, we'll talk about Megafood's relationship with GI and inflammation. And not Megafoods, let's just talk about the gut for a second. What we're looking at here is a scanning electron slide of some enterocytes, or villi, if you will, in the small intestine. So what we have here on the left is some healthy villi, and on the right is some damaged ones. Now what happens here? What is it that, what am I trying to highlight? Is simply that what happens at the gut really ends up affecting all the other organs in the body. It affects how we think, it affects our emotional state, it affects how the cardiovascular system works and so forth. And I think that this is a nice place to start. So if we talk about the gut, for instance, we have to talk about leaky gut syndrome. And initially when I was building this presentation, I put leaky gut in quotation marks. But I realized that's no need for that. We can just talk about it freely because it's really a well-identified syndrome or pathological state, and we all get it. We know that we get leaky gut syndrome all the time, every day. This happens from stress, from not eating, from eating poor, like having poor dietary choices, not getting enough sleep, whatever that is, that sedentary lifestyle that we're engaging in, that's putting stress on the gastrointestinal system. And what I'm representing here, or trying to represent here on this slide, is that what we'll see is that there's food triggers that will end up resulting in more systemic types of inflammation. And not only systemic, but certainly as well at the level of the gut. So you can see, we're just saying some of the big players here in the diet are things like gluten, dairy, and eggs, which can cause intestinal inflammation. And this is really what I want to highlight here, because this is we're going to come full circle and bring this back later here in the presentation, is that these foods will trigger the immune system. As you can see, you have things like antigen-presenting cells and T cells, and this goes down into your mast cells, and you get histamine release and so forth, and you get this inflammatory reaction. Now, whether this is a sensitivity or a true IgE inflammation, it tends to have, it can have a similar starting point, but ultimately we're talking about an effect where the immune system is causing inflammation. So I just pulled this up here, this little study, and there's one line I wanted to talk about here. It says, increased intestinal permeability is frequently observed in patients with food allergies or hypersensitivities. I don't see any of you guys going, oh wow, that's surprising. But what I'm saying here is that hypersensitivities and food allergies are part and parcel to maintaining a healthy gut system. This is really key for us to be able to help balance that microbial system, so that what we're really working with and seeing is these guys, where we're able to absorb nutrients, assimilate nutrients, break them down effectively. When we start running into this terrain, we get food sensitivities, food allergies, irritable bowel syndrome, inflammatory bowel conditions, all which in a large sense stem off of the same thing, which is the immune system. So how do we deal with it? Well, first off on the front end, I want to talk about quercetin. What does quercetin do? Anybody know what quercetin does?
It lowers antihistamines?
Yes, it stabilizes mast cells. And mast cells are This little dude is having a bit of a fit back here. I don't know if you can see that properly or not, but he's releasing histamine. He's released his granules. And what happens? What happens when a mast cell starts becoming disrupted? It creates permeability everywhere. It causes things to start leaking, which allows the immune system to come in and mount this inflammatory response. Now this is obviously important because if I need an immune response somewhere in the body, these mast cells release their histamine and it causes permeability at the level of the blood vessels, and the rest of the body can get in there, the rest of the immune system can get in to do its part. But what happens under times of stress? What happens when we have a leaky gut or an inflammation pathway in the gut that's existing? Well, these are going to start to degranulate and release histamine more inappropriately. And this is what we start to see with things like seasonal allergies or in other individuals that end up having more inflammatory-like pathways or burden in the body. And this oftentimes can start at the level of the gut. So quercetin, before I get off it, I should probably hit the highlights here. So you can use quercetin to stabilize the immune system, to reduce the effective sensitivities or perhaps even allergies, depending on the type that we're referring to, and certainly start to mitigate or pull back some of the inflammatory burden right at the level of the gut and the GI. And that's important because that's really where this starts at. If you can deal with the inflammation at the level of the gut, and I'll try to make a compelling case for this as we go forward and add layers to this story, that things like quercetin and mast stabilizing activity or stabilizing the immune system can be very helpful downstream to prevent other systemic effects, because what happens in the GI system is not only isolated there. That can cause systemic inflammation, and of course, as we know, that can lead to more insidious consequences. So as it says here, we can use this not only for what I'm discussing in the gut, but all of these other reasons for things like seasonal allergies, because of that same overactive response to the immune system, and that's kind of that. So there were some changes to quercetin, if you guys were using it or familiar with it. We removed the Food State Farm Fresh blend, and what we did was we tried to make a more concentrated approach here, where we added Food State vitamin C, had the mixed bioflavonoids, got the nettle leaf, eyebright leaf extract. So we still have this whole food complex, which is able to provide this antihistamine-like effect and these quercetin levels in the body. My personal favorite place to get quercetin, red wine, but I'm a sucker for red wines. But certainly not a bad choice either when we're talking about this. And if you have somebody with inflammatory bowel issues, sulfites in wine don't tend to work, so get more with the neg food. There's other reasons that we can create leaky gut other than just food. Bacterial triggers, all these different bacteria can cause an inflammatory response here. And so these bacterial components will end up getting into the immune system again, and at the level of those enterocytes in the small intestine, and these end up releasing things like you have this cytokine and reactive oxidative species reaction, and you have nitric oxides, proteases, and econocides, all which lead to an inflammatory damage, to local mucosal inflammation. So we're not absorbing our nutrients very well, we're not assimilating them, and downstream, if this happens for a long enough period of time, we end up running into problems. This is just another way of looking at this, and I want to highlight something. If you guys remember this, I've talked a little bit before with you guys on just very briefly on things like epigenetics, and you'll know that what happens with the bacteria or that food, that's offending to the body. This will actually trigger these things like TNF-alpha, tryptocurcumin factor alpha, and NF-kappa beta, and this reactive oxidative species, all of which end up developing this inflammatory role. And this will happen at the level of the genes. So you end up getting the bacteria, which causes this immune cell response to end up going in and changing the way that inflammation markers are being expressed. So you lose the entire integrity and health of the whole system in and around that area of the gut. So the whole gut starts to fall off. All these cells start to capitulate and give in and end up changing their expression to be inflammatory and damaging. And if you just notice this last little bottom pit here, it says autoimmune diseases, but that can certainly be replaced with a number of different titles. But what I'm getting at is that this isn't only local, it's systemic, but there's consequences for both, of course. Just another way of looking at it here, just inflammation that's happening, triggering these inflammatory cascades, NF-kappa beta, TNF-alpha, interleukin-6 pathways we want to avoid oftentimes. These are important pathways under certain circumstances, but in our general everyday life, we want to be shifting the balance to these less inflammatory burdens. And so, just to hit home on this systemic effects, this is a really interesting study that talks about the gut-brain barrier in major depression, intestinal mucosa dysfunction with an increased location of lipopolysaccharides from gram-negative enterobacteria causing leaky gut plays a role in inflammatory pathophysiology of depression. So leaky gut's relationship to depression here. There was only one study I could find on it, and I will be honest, there's a bit of a paucity in the literature from what I've been able to see relating some of these things like leaky gut syndrome to more systemic consequences. But this is important, I think, to understand, and we often miss that. The gut is such a foundational piece. Imagine that we have a patient with adrenal issues, thyroid issues, depression issues, and what we're doing is we're trying to home in on those organ systems, and we're missing some of the basic vital components at the gut. And those are broken down because we're in stress pathways and we're not able to deal with it. We're just, our purview is too narrow, so we miss the bigger picture. And we miss that foundational piece that naturopathic doctors love to talk about, that health starts at the level of the gut. I found this really interesting, compelling, and surprising to myself that I could find a human clinical trial or study to highlight that. This is interesting. So, mechanism of action by things like probiotics. Probiotic organisms inhibit NF-kappa beta and IL-8 production. That's why I kept harping on this guy back here. IL-8 production, NF-kappa beta, radical oxidizing species, or reactive oxygen species, ROS, whatever you want to call it. It all works. That is the inflammatory pathway. So probiotics themselves have this ability to inhibit that inflammatory pathway. That's really cool. And I like this. This is a really fancy way of saying here that it rearranged the cytoskeleton of the epithelial cells of the gut. It means that they weren't showing as much damage in there. They weren't all falling off the wagon and falling down that inflammatory cascade. I found that interesting as well. So reduce the probiotics, and in this case, they were specifically looking at, they were looking at different ones. There's a different study I was thinking of. But it reduced the E. coli-induced rearrangement of the cytoskeleton and drop in transepithelial resistance that ordinarily accompanies binding pathogenic E. coli. So this pathogenic E. coli wasn't able to damage the cells, which means that we had less incidence of things like leaky gut and less of those systemic consequences that follow. And this was kind of cool. It talked about bifidobacterium, showing that this microbe reduced systemic pro-inflammatory markers in both the GI, systemic pro-inflammatory markers in the GI and non-GI, under GI and non-GI conditions. So this is probiotics. If you just take a probiotic, we're able to reduce the inflammatory burden not only at the level of the gut, but throughout the entire body. The implications for that are very vast and quite large, and we oftentimes don't necessarily give credence to that.
So they're using the Infantis strain. Were they using that on adults? Because that's normally used in infants.
Yep. So you can use Bifido Infantis on adults. Absolutely, there's good trials in both. For sure.
Interesting. I didn't think it would naturally sort of stay since we'd be by this.
Bacteria will have when we use probiotics will there's oftentimes we don't necessarily want them to stay the whole time, especially when we're talking about dealing with when we're using them for their kind of antibiotic effects. We want them to be more transient. Mm-hmm. So absolutely, you'll see that the Bifidobacterium infantis will show up in a number of different formats. So megaflora. So where does this all lead us to? How about using probiotics? I bet you guys didn't know that I was walking down that line, did you? So Megaflora here, made by Megafood, is, I think, a really fantastic option there. I think that there's lots of great options that are available to us to use. 20 billion CFUs, strains that are naturally found in the GI, 14 synergistic strains. I'm a big proponent of having multiple strains in our products rather than just trying to home in on one or two or three. When we're trying to use it for clinical use or trying to get an effect with our clients, it's I think important that we try to get as broad of a spectrum as possible. I like to say that it's not one species that does everything. Bifidobacteria infantis or streptococcal species or Lactobacillus acidophilus, they don't do everything that we want a probiotic to do, so to speak. They all do certain things very well. So if you want to have that large reaching effect, you need to reach out to, you need to be able to reach out to other strains as well in there. So the multi-strains are quite good. And from what I've found, I always grab a multi-strain probiotic when I'm looking at anything like a skin condition. That's my personal preference there. So, as we were saying, anti-inflammatory effects, it has detoxifying properties, able to re-heal at the level of the gut, and then beyond that as well. And with all our Mega Food products tested to be free of gluten, dairy, and soy, of course. You guys like this product? Never tried? You guys like it? There's one at the back there. You guys should pick it up if you haven't tried it. I put this one in very quickly, Megazymes, so broad spectrum digestive enzymes. It also has Lactobacillus acidophilus in it, so if you want, or if somebody's looking for a little bit more, you're looking to kind of coat and deal with perhaps some of the damage that's already in the GI, or maybe you want to couple this with your Megaflora, that would certainly be an acceptable way of doing it as well. Maybe Megaflora in the morning and a Megazyme at night, or other way around. What you have in here as well is you have astragalus, ginger, marshmallow. You know, and this is nice because this acts as a demulcent, the marshmallow, able to soothe inflammation that's happening in the GI. Astragalus, good for nutrient assimilation, but also really a foundational herb in Chinese medicine for working with the immune system. So being able to benefit that immune response, helping to prevent an overreactive immune response that leads to some of those consequences that we were talking about there. And again, of course, tested to be dairy, gluten, and soy free, and 100% vegetarian. Okay, so moving inward, this is a little diagram of TCM theory, traditional Chinese medicine theory, and as I wrote that up on the right, I said from the GI to the Tai Yin. It sounds a little bit like a rap song. So I wrote a rap. No, I'm just kidding. But what we're saying here, and what I was trying to highlight, is that, you know, if we can look at pathogens in the broader sense, including things like stress and so forth in this picture, rather than just things like bacteria or viruses, is that, you know, in traditional Chinese medicine, what we say is that when they're on the outer regions here, it's much easier to deal with. We have a much, you know, it's much easier to deal with curing or being able to remedy the issue or the pathology at hand. So, you know, if it's just at the level of the GI, not such a big deal. But as I'm really trying to highlight here, the health of the GI translates into the health that ends up into the internal terrain. So you end up getting into this inner circles, and you have to start changing the way that we approach our medicines from that. Does that make sense? That's all I'm trying to highlight there. And one of the things certainly is that if we're in a state of inflammatory burden, we need to be cognizant of how we're balancing the sympathetic and parasympathetic nervous systems. For two reasons. I think that there's a bilateral relationship there, so it's not just that inflammation causes an imbalance in the nervous systems, and it's not just, it also goes the other way, where the imbalance in the nervous systems will create inflammation. So we need to be cognizant of this, and I see on a daily basis that we are consistently in the sympathetic side. And what happens when we're in the sympathetic mode, when we're not giving ourselves the opportunity to slow down here and be in the parasympathetic side with the nervous system? You guys know what I'm referring to when I say parasympathetic and sympathetic nervous system. Sympathetic nervous system simply being that this is our fight or flight response, our stress response, and the parasympathetic, which allows us to have appropriate digestion. It allows us to be calm. It keeps us in this cool state. And our culture really pushes us into this sympathetic division of the nervous system. And what are the problems with that? Well, if we're constantly having our stress hormones active, I'm sure you can see what's going to happen. We're going to end up with other health consequences, which are multifarious. They wear many faces. But on the level of the gut, what happens is that we shunt blood away from the digestive system when we're in the sympathetic mode. Because when I'm trying to run from the bear, as we evolutionarily have evolved, I'm not concerned with having blood in my gut. I don't need to digest at that moment. I need it in my limbs. So what happens when I shunt the blood away from that system? Well, I can't digest appropriately. That leaves us vulnerable to the leaky gut syndrome. It leaves us vulnerable to the inflammation pathways that happen. So balancing this is very important, especially as we go from that external, where we're at the level of the gut, to the internal terrain. So that's my nice segue into adrenal strength. We need to be able to balance these nervous systems, the compartments of the nervous system appropriately. And this can help for sure in part at the level of the adrenal glands here. The adrenal glands have a pivotal role to play with that because of their secretion of catecholamines, things like dopamine, epinephrine, norepinephrine. These are a number of our stress hormones in the body, and if we're constantly overworking the adrenal glands, there's two things that I like to kind of highlight here. The first is that, well, we're in that constant state of sympathetic drive, and if we need to go eat at lunchtime, we can't just turn that off. It's nice for sure if we decide to just take a few deep breaths and try to trigger that parasympathetic nervous system, but on a whole, it's very difficult to just shift the body in that regard, if that makes sense. So the longer we train ourselves, the more that those hormones and the catecholamines get secreted, the farther we are into this stress-based system and stress-based mode that's happening. So let's balance that. Let's use what we call adaptogens and things like adrenal strength, which has all of these different adaptogenic herbs in it, to be able to deal with that, to be able to deal with this stress, to manage stress, to be able to allow the body to effectively deal with the stress so that it doesn't become dysfunctional and lead to further down the line pathologies and so forth. The adrenal strength was reformulated recently. And I'll get to that in a second. I wanted to say the second thing that happens with the adrenal gland story. I said first off, we get this overactivity of the adrenal activity. Well, there's also things like cortisol in there, of course, that are being secreted. And the adrenal glands, just like all organ systems, they can get fatigued. And I think that a good analogy is what we know with the pancreas and diabetes. When we look at diabetes, what happens? We're just constantly feeding the body sugar. The pancreas is just pumping out insulin, 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 and eventually says, I'm done with that, I'm stopping, no more insulin for you, and we end up running into things like type 2 diabetes. The adrenal glands have a very similar activity. If you're just going to constantly jam them and have that overacting, that drive of sympathetic nervous system, they eventually start to slow down and dysregulate their secretions of these hormones and dysregulate their secretions of things like cortisol, and we start to see things like chronic fatigue syndrome, burnout, simply difficulty getting up in the morning, brain fog, brain fatigue. So there's these two camps in which the adrenal glands need to be supported with different adaptogenic herbs. Now to where the adrenal strength has changed. So adrenal strength has changed because we reduced the vitamin C. We took it down from 100 to 80 milligrams of B5, from 50 to 30 milligrams, and we totally removed the potassium. Farm Fresh Fruit Blend, American Ginseng, Amla, OPCs, carob, and lycopene. And the reason we did that was to create a more directed formula here. So we increased the sensoril ashwagandha to 250 milligrams, to the therapeutic dose here that's been studied with sensoril ashwagandha. We increased the holy basil to 175 milligrams. A fantastic, as it mentions there, it's an Ayurvedic herb, but it also has antimicrobial components. We just talked about how inflammation at the level of the gut and how the imbalance of bacteria at the level of the gut can cause inflammation on a systemic level. It's able to deal with that, but it's also a true adaptogen in the sense that it helps to balance the entire HPA, hypothalamus, pituitary, adrenal axis in the body. And we added rhodiola. I love this combination on a whole. These three adaptogenic herbs, I think, fit the bill for a very large umbrella of individuals who are suffering with adrenal fatigue issues. Rhodiola is one of my favorite herbs to use in the context of getting people back and going right away. I learned this trick from a bit of a mentor of mine in Toronto. He used to use it in this way, and I basically just co-opted it from him. He would use rhodiola for the first 2 weeks in particular, and he'd give it to him in a loading dose. So he used to say, if I just need to get, I'm just going to give them 2 weeks here. If they just need 2 weeks where they're just going to kind of be balanced, I just dose them up on rhodiola. And then that gives me 2 weeks to kind of deal with the underlying concerns and so forth, and gives us a bit of a starting window to go. And then we can kind of either continue on with rhodiola or change it. But rhodiola has this very good effect of being at creating an effect on the adrenal glands very quickly, and a very good way of just kind of, if I can use the analogy of just keeping people in check. And he used to say, hey, it kind of works in that 2-week window, and I would tend to agree with him on that. That's a pretty good time frame. So I love this overall combination, and I love that they added rhodiola in there. So those are the changes there. What happens as we go from the adrenal glands? We have to also look at the thyroid. And I will always work with my patients' adrenal glands if there's thyroid concerns. Sometimes I'll work with the adrenal glands for the first month or 2 months before we start even addressing the thyroid if I think that the underlying issue is that there's an imbalance in the adrenal hormones that are happening and that's causing a low thyroid activity. But again, why is low thyroid activity becoming more of a burden in society today? We're not absorbing our nutrients effectively. We're constantly in a state of sympathetic overdrive, and that drives inflammatory burden on the body. It shifts the body away from the metabolic processes that allow it to have functional regulated thyroid gland, or functional regulated adrenal gland, and so forth. Or same thing with the pancreas. Why do we have this epidemic of diabetes? We stress the pancreas too much, and you guys understand why we do it, but you guys can figure out all the reasons that happens. Same thing here. So when we're talking about the thyroid gland, what we want to be able to do is produce thyroid hormone. We also want to be able to convert it to its active form, so we want to get it from T4 over to T3. As it says, a sluggish thyroid can lead to fatigue, it can lead to weight gain, sensations of feeling cold, so poor circulation, brittle nails, dry skin, thinning hair. And so the thyroid strength is the synergistic balance of food state nutrients and herbs that support normal thyroid production, optimal weight maintenance, metabolic regulation, and overall sense of well-being. So it helps to increase overall energy levels, can help and be an important component of weight management if there is low thyroid activity. So this is a nice product for that, for those reasons. And again, I encourage you to consider using this alongside the adrenal strength. Maybe use the adrenal strength for the first 4 weeks or 2 to 4 weeks, and then you add this on and you take them at the same time. But I think that that's very important for individuals who are looking to grab a thyroid supplement because they have low thyroid activity. So what did we change here? Well, we reduced the L-tyrosine to 300 milligrams, which is, as they say here, a foundational supplement dose, so which is simply to say it's the dose that we need to induce an effect here for converting T4 to T3. We removed this blend of different herbs that are known to both produce thyroid hormone and help convert it to its active form. And why do we do that? Well, we increase the selenium and kelp in there. So the selenium is very important for transitioning from T4 to T3 in that pathway to thyroid hormone's active form. And kelp is a rich source of iodine. And it doesn't matter how much T4 you have in your body. So Synthroid, while it is a pretty good medication, it's a synthetic form of T4. If you're lacking essential minerals because you're not absorbing them, or your body is under a lot of stress, which is to say it eats those minerals up, so inflammatory cascades and stressful circumstances will eat up things like your B vitamins, your seleniums, your tyrosines, all very important for the thyroid gland and other glands and other organs in the body. And what happens there? It leaves you deficient. It leaves you in a state that makes you quite vulnerable. So the selenium is there to convert the thyroid hormone to its active form. I get asked a fair amount, can you use this with thyroid medication? I said, absolutely, but make sure they're getting monitored by their healthcare provider. But again, I think that because Synthroid is the most commonly prescribed medication and it is in a synthetic T4 form, and the fact that most hypothyroid cases, by my estimation, are the result of overburden and stress, which means that we're probably low on the essential minerals and vitamins to convert it over, it's a compelling reason to use this alongside it. Of course, ensure that they are being monitored by their healthcare provider. And we added zinc and copper. Again, this is important. These are just important nutrients as cofactors for producing thyroid hormone and converting it to its active form again. So I like this. I like both the adrenal and thyroid because we've developed more concentrated formulas here as a result. Any questions on those? Now on to my second rap song.
from the thyroid and adrenal glands to the joie yin.
So what happens when we get even further internally? So what happens when we get past the adrenal glands and the thyroid glands? What happens when this dysregulation and inflammatory cascades and this burden ends up becoming more chronic? Well,